let's go for the last part of the class today. So we have discussed about social cognition and social cognitive processing and how social cognition is important in terms of being able to communicate with others. But meanwhile, the question is how much social cognition could be impaired in different clinical population. We have done a study something like 15 years ago with the idea that, okay, all these prefrontal cortex functions we discussed that should be important for social cognition, they could be affected by drug use. So we have been thinking like, okay, we have been seeing that people with drug addiction, they probably can have issues with social cognition. And you might in the first step feel that, okay, I mean, why drug addiction would be related to social cognition? But at least in my clinical practice, I realized that even in the clinical practice, this is something really frequently happening, that patients with substance use disorder, they cannot read your mind from your eyes. Sometimes when you are interacting with them and they have some misinterpretation from what you are communicating with them. And that is amazing for me, that how much they may make those misinterpretations, or they make misinterpretations from others social interaction with them in the clinic. So they can tell you that, okay, I mean, this person, I mean, behind the pharmacy bar, she was interacting me in the way that I was thinking that she was sort of kind of flirting with me or doing this sort of interaction with me. But when you get back and you just see the videos, you do not see any evidence for that. So you can just see that how their social cognition is impaired. And we know that there are lots of evidence in terms of kind of impairment in different brain areas that are involved in social cognition among substance users. But it is amazing for me that I realize that this is one of probably the first studies that people have done in terms of evaluating social cognition among substance users. And this is exactly what we have done with the eyes task that I showed you. I've never seen people replicating that and following that line of kind of studies. But that might be something interesting that if people would be interested to explore in the future. I can see that it's not just about, we have all heard about the kind of autism and kind of impairment of social cognition in people with autistic spectrum. That is the main focus of studies in social cognition. But there are definitely other clinical populations that their social cognition would be affected. And I can see that there are interesting potentials for that area of research, exploring how social cognition is impaired in people with different clinical disorders. If you want to try to, let's say, define a process of evaluating people for social cognitive deficit and then providing them with treatment. So evaluating them and then giving them a diagnosis and then giving them treatment and then following them up with the idea of kind of social cognitive interventions. That is a type of the kind of social cognition clinic that might be interesting to be explored. But in reality, probably social cognition training or social cognition improvement or social cognitive assessment, it is not something that people have been exploring substantially before. There are areas like schizophrenia. We know that people with schizophrenia, they have significant problems with social cognition. But the question is, other than schizophrenia that people have impaired social cognition, how other psychiatric disorders might be impacting different levels of social cognition, and do we have any intervention specifically targeting social cognition and trying to improve social cognition? And even in the, let's say, among kids, how many interventions do we have to help them to improve their social cognition and the social cognitive interactions? That is something that I think that would definitely be really interesting target and topic for further development and further kind of research in terms of developing interventions to improve these functions. And there are people who are developing interventions, but that is going to be an interesting topic for further discussion. Let me just conclude what we have been talking with one single remained kind of study that would give you a better sense about another aspect of social cognition, which is what I call social rank or social dominance. To give you another idea that, I mean, when we talk about social cognition, it is not just about shared attention or reading the mind from the eyes or complex human interaction. It could also be related to what we call in the social context, the hierarchy. So how being in different levels of hierarchy within a society, or being kind of interacting with different levels of authorities within the society might impact your brain. That's another aspect of social cognition that sometimes is being ignored, but it's a really critical part of social cognition that we need to take into account significantly, and we need to think about that. In this really interesting study, people brought monkeys that they have been basically taken care of before as something like individual monkeys. So they have been something like pets in different places, so they didn't have very much social interaction. And they put them together in something like a socially housed environment. So they put them together to be able to develop as a sort of a society together. Okay, so that was the study of putting them together to develop a society. And then they realized when they get into a society, they would start to develop what we call social ranking among each other. And you might feel that, okay, how we can measure social ranking among monkeys? Saying that, okay, this monkey is the big boss, the other one is a boss, the other is something like a subordinate guy, this one is going to be a follower, this one is a leader. So how you define the social ranks among monkeys? Do you know how we define social rank among monkeys? What is the best predictor of your, position of a monkey within a social rank, within a kind of community that they have, defining their social rank? Anybody who has any idea about that? How we define social rank among monkeys? Color? What else? Age? Size of the body? What are the factors that we can tell that, okay, this monkey is in a higher rank order and this monkey is a subordinate in the power? Okay, the best predicting factor whether the monkey is in a higher rank or lower rank is what we call grooming behavior. So I'm sure you have seen that monkeys are grooming each other, something like doing this and just bringing out the pests from out of the skin and trying to clean the others. So it is not something that one monkey is doing for another for a monkey and the other would just do just giving back and do the same for the same monkey. It is not the case. Monkeys would have specific social ranks. So when you have one monkey grooming the other monkey, they are basically interacting. So it is not paying back to the other. The subordinate monkey would just groom the higher ranking monkey, and then the higher ranking monkey would just groom the highest ranked monkey. So they just do the grooming process in something like a really social ranking process. And if you see who is grooming who, over the time you will realize that, okay, what is the structure of this society in terms of the rank, and who is on the top and who is on the bottom. And the monkey who is on the top never would groom the monkey in the bottom. So it is not a payback process. So it is the level of the interaction in the community. So they start to develop a social rank over a time, and one monkey would be, something like a more dominant monkey, and the other monkey would be the kind of less dominant monkey. If you just evaluate the level of dopamine receptors, okay, in the monkey, when he was individually housed compared to the time that he is socially housed and being a dominant socially housed would be 22% increase in the level of dopamine receptors. Okay? So the dominant one, this is the level of dopamine receptors in different parts of the brain, including nucleus accumbens in the ventral striatum. Okay? So you can see that the level of dopamine receptors doing PET scanning would be much higher after being socially housed. But for those who are subordinate, based on their rank, the level of increase in dopamine release would be much lower. So as you can see here, there is still a slight increase when they go to the social environment, but it is not really significant. So this one would have the highest level of dopamine receptors. And the higher your dopamine receptor, the higher the pleasure that you would get with the same amount of dopamine if you release dopamine. If you put these monkeys in an environment and then you start to give them cocaine, okay, and see how much cocaine they would use. The subordinate monkey would significantly use higher level of cocaine. So it seems that they need more reward because this guy has already have enough reward, but this guy basically starts to use more cocaine. And this is not just about cocaine. Whatever reward you provide for this two animal, the subordinate one would get more kind of impulsive to get reward, whether it is food, any other types of rewards. This one would be more sensitive in terms of trying to get more rewards because, I mean, he has a kind of lower level of dopamine receptor, so he needs to kind of fill the gap with other rewards. And that is the reason that this monkey would be much more susceptible to get dependent to cocaine. And if we see over the time, when the monkey would start to get dopamine, over the time, the level of dopamine receptor would go down and down. So it is just something like a vicious cycle and negative reinforcement in a way that even the limited amount of dopamine receptor that the monkey had, he would lose those receptors over time because of receiving cocaine. And that would make even the negative impact more and more powerful. So you can see how much it is critically important for you to have a specific rank within the society in terms of how much you are in control, in terms of controlling the level of food that you take or the level of drug that you take, and how much you are able to manage the amount of pleasure that you can get from what you do. And sometimes I receive feedbacks from my colleagues and students in other places around the world. I mean, these days things are, about immigration and how we can kind of immigrate to other countries, how we can go from, let's say, from Turkey to US, from Italy to US, from, all around the world to other places that might have better living opportunities. But something that people miss, especially those who are in high social ranks in their own societies, when they leave their own society and they leave those so high social ranks and they go to other societies, even when they have better, let's say, environment, but they are in the lower social rank, they would lose a significant amount of kind of reward that they receive from social interaction. And that is going to be a really big gap that most of the time they cannot fill with anything else. And that is going to be critical in terms of when we talk about social interaction, the role of social interaction in the reward processing in our brain is critically important. So we cannot ignore social interaction. Basically, we cannot ignore the role of social interaction in reward processing in our brain. And I highly recommend you to consider that in terms of how social cognition is also contributing as a source of reward, and how being socially empowered in your own society would contribute in terms of the level of external reward that you need to take to be able to keep a minimum balance in your life. And there are lots of kind of implications for these findings in terms of how social cues are playing a role in terms of the social cognition. I just wanted to kind of finish the discussion with this really beautiful photo in terms of how these monkeys are interacting with each other. And I was going to kind of suggest you to try to read the minds of these monkeys from their eyes and tell me what are the things that are happening in their mind and what they are thinking about right now. So this is the last slide of our discussion today. I hope that you enjoyed the discussions that we had, and hopefully see you next week the same time.